Thank you so much for being here today. I really appreciate it. Can you tell us a little bit about yourself?
Well, good morning, Commissioner. My name is Dr. Jim Whitworth. I'm a professor at the University of Central Florida, where I focus on training and preparing graduate students to be clinical social workers for military members, veterans, and their families. Along with that, I also do research into the better interventions or trying to identify and understand interventions for military members that have post-traumatic stress disorder or PTSD.
What is the main focus of your PTSD research?
Primary focus for my research is really looking at what we call the gaps in the research. As you think about it a little bit, there are thankfully some solid research-based interventions for military members and veterans and even families who have signs of post-traumatic stress disorder. Unfortunately, for veterans though, even though they're solid and somewhat available, half will never go and participate in those interventions, and half that start them stop them early or don't continue them on as long as they would benefit from them as well too. So the focus of my research along with my colleagues has really been to try to understand and identify those interventions where veterans will go to, and not just start, but they also complete them as well too, and ones that feel that they're benefiting from as well too. So we focus in on those. They're called alternative or complementary, or in some cases adjunctive treatments. They may be getting sort of medication from a medical provider, but then in terms of sort of the other help, so most particularly that's service dogs for veterans with PTSD, in terms of my research, and then equine therapy, where you provide a research-based intervention along with equines or horses available as part of that process.
So what you're doing is looking at different ways you can possibly treat PTSD and
Exactly,
veterans.
for veterans, yes ma'am.
And trying to find the most effective ways.
That's correct.
What has been your most consistent findings?
Well, thankfully, we're really identifying some consistent themes along with veterans who like to participate in these alternative treatments, and looking at equine therapy and service dogs for veterans with PTSD. We know that veterans just seem to love these interventions. They really will participate in them. They'll start them, which is a big step, and then they'll complete them as well too. But what we're noticing in terms of pre and post tests and sometimes long-term assessments is that they're showing improvements in their PTSD symptomology, most particularly related to the symptoms that many times veterans say are the most difficult for them, and that is usually their mood, being able to manage their mood, and then also decreasing their social isolation. Many veterans who are dealing with PTSD will really kind of reduce their interactions with society, and even really kind of cutting off themselves from people that care about them the most, their family, their spouses, their children as well too. Yeah. But veterans seem to be decreasing those PTSD symptoms after they participate with training a service dog and having a service dog, and that's shown consistently over time. And then also those that participate in equine assisted therapy as well too.
What does the assessment and treatment look like?
But for assessment generally is for a veteran who is dealing with PTSD or a family member who wants them to be seen for that. It will involve usually an interview, of course, with a licensed mental health provider like myself, or even their physician, a medical provider as well too, can do the assessment. But part of that's usually going to be some standardized assessment tools, some written assessment tools. But the key we're also learning there from the research in terms of making sure that assessment is as adequate and helpful or accurate even, is that it's really veteran focused, and it goes at the pace that the veteran wants. It isn't rushed, and it's very personable, very focused on that veteran. Also, and I meant to say this earlier in terms of the research findings, we know that veterans seem to benefit from interventions that get veteran and military culture. We have our own subculture and cultures as well too, just like many other cultures do. So having providers or individuals that do this kind of work, that understand that in the assessment and intervention process or any sort of program, really makes a big difference, and veterans pick up on that real quickly.
Along those lines, what are some of the misconceptions that people may have about PTSD and veterans in the military?
There's some big ones out there. A number of folks might think that these veterans are somehow weak or broken, but nothing could be further from the truth. In fact, these are, they've all, in many cases, these veterans have demonstrated incredible resiliency through working through challenging situations during their military deployments or their military experience. And many times they're really hesitant to even talk about this stuff, or their experiences or their symptoms. So that's a major misconception as well too. The other misconception, you see this in the media as well too, is that these veterans are likely to sort of blow up or be unpredictable or irrational. That's very, very rare among these veterans. So that's a major misconception as well too.
How can our community help support our military, our veterans, and the efforts?
Thank you for asking that. There are so many ways. And many of them are kind of informal. If you have a neighbor or a friend or a coworker that is a veteran dealing with PTSD, first thing is just to treat them like everybody else and engage with them, be friendly with them. It's just engage them as you would anybody else. Now, in terms of more formal involvement, there are so many solid, quality organizations that are seeking to help veterans in these situations. And we're very thankful for that. So volunteering at these agencies or supporting them would be incredibly helpful. Of course, I'm most aware of the agencies that I'm doing the research in, so the service dog work, like I know you've talked with folks at Canine Partners for Patriots over there in Brooksville, but they're doing great work. There's other agencies like that as well too. And then those agencies that are providing, equine therapy for veterans with PTSD. There's not as many of those as the service dog approach, but when you think about veteran service organizations like the American Legion, Disabled American Veterans, Veterans of Foreign Wars, and even newer ones like Team Red, White, and Blue. These are all veteran service organizations, oftentimes started by veterans and people that care about them, that really are there to help them with the transition process and to really help with all of this as well too. Now, if you do have somebody, or if somebody is aware of a family member or somebody they care about who has openly difficult PTSD symptomology, or they want to get help for them, I think engaging with some of these agencies and trying to, and also the VA does a wonderful job. They really are trying to be veteran focused and to use solid research-based approaches to help our veterans.
What does the future look like for PTSD research?
In terms of research? Well, we're very curious. So really in terms of these alternative treatments I've been talking about, we're really kind of at the beginning part of that research and discovery process. So more and more studies are seeking to try to control what's happening, to really do a solid comparison of the different interventions, or maybe a randomized controlled trial of assigning people to different types of interventions, some with more standard approaches, maybe with limited approaches, and then some with the alternative treatments as well too. So more of that. But to be honest with you, also for the future of the research, we're also very concerned and want to make sure that individuals in our country don't forget the role that these veterans have played to serve our country. And with time being longer and longer since our last open conflicts in Iraq and Afghanistan, there's a concern that individuals and even government agencies might forget about the need to support these veterans and provide solid research into these interventions as well too. So that'll be an important component as well too as we move forward.
Where can viewers go to learn more about this topic and how to get some help for their loved ones?
You bet. There's a number of really good websites. The Center for PTSD Studies, actually founded by and provided by the VA, has tons and tons of resources for individuals that might want to volunteer, or really first off understand what these individuals are experiencing, these veterans are experiencing. So tons of research or information there for researchers like myself, but also for many just community members, family members, or even veterans themselves. The second website I would really recommend is the Center for Deployment Psychology. Tons and tons of research, particularly and information there, particularly for family members, but also for other providers and researchers, sort of a wonderful forum where all that information is available. And then all the veteran service organizations that I mentioned earlier also have some solid information on all of their websites as well too about PTSD.
Well, thank you so much for being here. I really appreciate it, and I appreciate all the work that you're doing.
My pleasure. Thank you.
If you're enjoying this show, please subscribe to our channel and follow our Instagram, Facebook, and Twitter accounts.